Hey everyone, welcome back. Angie with Omega Star. In today's video, we're going to be continuing our puppy health and development series that we started. And we're going to be talking about umbilical hernias, inguinal hernias, hooded vulvas, and undescended testicles. Again, I am not a vet. What we're going to be covering today is for educational purposes. It comes from my experiences, conversations with families, raising puppies. And so we're going to just dive right in. First, we're going to talk about umbilical hernias, what to be concerned about, the treatment of it, the lifespan, or any kind of complications that happen with those. Puppies are born, some of them have umbilical hernias, some of it is genetic, some of it just happens because of the birthing process. And it is really just an opening in the tissue that has a little bit of a bubble. It's like a soft bubble there. You can at times have the intestinal tract be pushed through that little opening, but more than likely it is just a soft, like fatty tissue that's in there. And so it can be kind of alarming. It's like a little outie belly button, in other words. However, it's a simple fix. You can actually have it corrected when you spay or neuter your puppy, or if your breeder has the option, they can take care of it prior to spay and neuter. As young as 6 weeks old, it can be taken care of. And it's just a simple incision. The vet goes in and tightens things up, and then you just have a couple stitches that you remove around 7 to 10 days. My personal experience with it, I've had a couple puppies over the years have those surgeries, and it's very, it doesn't take a lot out of them. They're calm for a couple days, and then they're able to move around with their litter mates. There is a little bit of isolation that needs to happen during that healing process just because there's stitches in place. And so we really don't want another puppy tugging on those stitches. But really by 7 days, it heals up nicely. Occasionally there's just a little bit of a raised area where the stitches were. But once those are removed, it softens down, and usually the hair grows back over it, and you would never know that they had a surgery. There's another type of hernia, and it is an inguinal hernia. It actually happens down in the groin region, so it can be a single side, like an isolated side, or it can be bilateral, which means it's in both sides. It's again just tissue that is pushed through the muscle wall. And if the vet needs to repair that prior to the neutering process, if it's a male, she's going to ask that they go ahead and do the neuter as well because of the way all of the genitals are formed down there. It's a female. Females can just have those inguinals repaired. It's again a very simple surgery. It's nothing to be alarmed by. Generally, if it's taken care of as a young pup, they live a very long lifespan, and there's not a repeat of it. Again, this is just from experience. I'm not a vet, so having those conversations with your vet or your breeder, they would have the experience in their back pocket to discuss with you. But the majority of homes who are looking for these puppies to be their forever pet, these types of hernias in a repaired situation are completely, would have nothing long-term in the life of the dog. If you are possibly looking at one of these puppies to be a breeding prospect for you, you may want to consider a different puppy because there can be genetic lines that are attached to it. It's just difficult to know right up front whether that is the condition or not. From my experience, there are no long-term conditions that go along with having a puppy that has a repaired hernia. So don't be alarmed. Don't be afraid of it. Talk to your breeder. Talk to your vet, and then make the right decision for you and your puppy. It is okay also to wait to have an umbilical hernia or an inguinal hernia. Wait to have it fixed until they are of spay and neuter age. So you can make that decision as well. It doesn't have to be done in the early months. It can be delayed. And as far as my experience has, the outcomes are very positive. Some of your concerns could be the severity of the hernia, so that would be something to take into consideration, and then also the cost of repair. So those are conversations you would want to have with your vet and also your breeder. Sometimes as a breeder, we can have them repaired for less cost when the puppy is smaller than if waiting till spay and neuter much later in the months ahead. So those are just things to think through, have discussions, be open about it. And really the positive outcome is that you can repair these hernias and these dogs live an amazing life. As far as severity of the hernias, they can range in size, they can range in the condition as well. And actually some of them can go away on their own. So waiting out the process isn't always a bad thing. Again, those are just conversations to have. Be open up front about it, and then just look at all the outcomes that could come from it. So the next subject we're going to talk about is related to females, and hooded vulvas is what we're going to talk about. There are many fears that can go around a hooded vulva, but truthfully, a female puppy that has a hooded vulva can live a very long lifespan without it being repaired. It just requires the family to have a little bit more attention to care. You just need to make sure the area is cleaned well, that it stays dry. Just to describe what it is, it's an extra skin fold that comes up over the vulva, and so it's almost like it disappears. And so if a surgery is taken care of or performed, what the vet will go in is cut like a semicircle. It's basically like cosmetic surgery. Cut out like a semicircle, restitch that, which allows the vulva to come back out of the body cavity there, like it should have been from birth. So again, it's nothing to be fearful of. So the surgeries are very successful. Again, your breeder and your vet may suggest that it's done early. I have had a lot of success in that department. There's just not as much skin to heal. And the risk of infection or UTIs later on in life isn't present any longer. So conversations to have with your breeder, conversations to have with your vet. Again, if you're adopting your puppy for just a pet companion home, having the surgery, the results have a really good outcome. If you're looking for that puppy to possibly be a breeding puppy for you, I would suggest that you choose another puppy because there are studies that show there's a genetic link to those hooded vulvas. But again, if you have the surgeries and you work with your vet and your breeder, you can have a really good discussion on what's best for the puppy and for your family. The last topic is undescended testicles, and it relates only to male puppies. So the concern is when your puppy is checked between 6 and 8 weeks, occasionally your vet record could show that it had an undescended testicle. What that means is one is just retained up inside of them. The conditions of that or concerns could be alarming. It may seem like it's a little scary, but rest assured that that puppy is going to live a really, really normal life. The things you'll just need to discuss with your breeder are what happens if that testicle doesn't descend. So generally it's between 6 and 16 weeks that it generally will drop down. If the testicle does not descend by 16 weeks, a conversation with your vet and also your breeder is a good one to have. Just inquiring on what the costs are going to be and what they recommend as far as timing for that neuter. So what happens during the neutering process is that they just have to really just go inside the body cavity more and look for it. And so it can incur a little bit more cost. And so you should have that conversation with your breeder, be open about it, and know the direction. So in case it doesn't happen and you find yourself in that situation, you already know what to expect. Generally, it's just a little bit more cost from your vet. Regions vary. Vets vary on their cost of things. And so it's just a good idea to be open about it and know what you're walking into. But it's not going to affect the quality of life of the dog or the puppy at that point. And so it's just something to be aware of. So the main takeaway from this video is I want you to just really know that as breeders, we really we strive for perfection. We want perfect puppies, but nature has its own way of giving us exactly what that puppy was created to be and to have. And so I just want to eliminate some of the fears from you. We just kind of covered some of the basics that we encounter in a vet check at 6 to 8 weeks. These conditions are not life-threatening, but if you happen to find that perfect pup for you and it happens to have a hernia or an undescended testicle or an inguinal hernia, those conversations that should be had with your breeder and your vet, they need to be open. You need to talk about the now and the future and just work through all of those options for you. So if you find yourself in this situation, there's really three things that you should consider. And one is cost, the second one is timing, and the third one is recovery. And so having those conversations of what will it actually cost me if I repair now or repair later? When is the best timing to do this? Is it now at 8 to 10 weeks, or is it really later towards 12 months when you spay and neuter? And then what is the recovery time? Is it best for your puppy to have it done early, or is it better later? All of those situations really are related to the severity of the condition, also your lifestyle, potentially your region and where you live, your vet costs. All those conversations are just really great to have with your vet and then also with your breeder. And I wish you well in this process. I want you to understand that as breeders, we really do strive for perfection, but we do have these little hiccups along the way, and they're nothing to fear. So I hope you enjoyed today's video. I hope it was educational for you. I hope it also spurs some interest. If you happen to find yourself along these pathways, know that we're right there with you. So have a great day, everyone.